The cardiovascular system shock and homeostasis. Shock is a failure of the cardiovascular system to deliver enough oxygen and nutrients to meet cellular metabolic needs. The causes of shock are many and varied, but all are characterized by inadequate blood flow to body tissues. With inadequate oxygen delivery, cells switch from aerobic to anaerobic production of ATP, and lactic acid accumulates in body fluids. If shock persists, cells and organs become damaged, and cells may die unless proper treatment begins quickly. Types of shock. Shock can be of 4 different types. 1. Hypovolemic shock due to decreased blood volume. 2. Cardiogenic shock due to poor heart function. 3. Vascular shock due to inappropriate vasodilation. And 4. Obstructive shock due to obstruction of blood flow. Hypovolemic shock. A common cause of hypovolemic shock is acute, sudden hemorrhage. The blood loss may be external, as occurs in trauma, or internal, as in rupture of an aortic aneurysm. Loss of body fluids through excessive sweating, diarrhea, or vomiting also can cause hypovolemic shock. Other conditions, for instance, diabetes mellitus, may cause excessive loss of fluid in the urine. Sometimes, hypovolemic shock is due to inadequate intake of fluid. Whatever the cause, when the volume of body fluids falls, venous return to the heart declines, filling of the heart lessens, stroke volume decreases, and cardiac output decreases. Cardiogenic shock. In cardiogenic shock, the heart fails to pump adequately, most often because of a myocardial infarction, heart attack. Other causes of cardiogenic shock include poor perfusion of the heart, ischemia, heart valve problems, excessive preload or afterload, impaired contractility of heart muscle fibers, and arrhythmias. Vascular shock. Shock may occur if blood pressure drops due to a decrease in systemic vascular resistance. A variety of conditions can cause inappropriate dilation of arterioles and venules. Anaphylactic shock. In anaphylactic shock, severe allergic reaction releases histamine and other mediators that can cause vasodilation. Neurogenic shock. In neurogenic shock, vasodilation may occur following trauma to the head that causes malfunction of the cardiovascular center in the medulla. Septic shock. Shock stemming from certain bacterial toxins that produce vasodilation is termed septic shock. Obstructive shock. Obstructive shock occurs when blood flow through a portion of the circulation is blocked. The most common cause is pulmonary embolism, a blood clot lodged in a blood vessel of the lungs. Homeostatic response to shock. The major mechanisms of compensation in shock are negative feedback systems that work to return cardiac output and arterial blood pressure to normal. When shock is mild, compensation by homeostatic mechanisms prevents serious damage. In an otherwise healthy person, compensatory mechanisms can maintain adequate blood flow and blood pressure despite an acute blood loss of as much as 10% of total volume. 1. Activation of the renin-angiotensin-aldosterone system. Decreased blood flow to the kidneys causes the kidneys to secrete renin and initiates the renin-angiotensin-aldosterone system. Recall that angiotensin II causes vasoconstriction and stimulates the adrenal cortex to secrete aldosterone, a hormone that increases reabsorption of Na and water by the kidneys. The increases in systemic vascular resistance and blood volume help raise blood pressure. 2. Secretion of antidiuretic hormone. In response to decreased blood pressure, the posterior pituitary releases more antidiuretic hormone, ADH. ADH enhances water reabsorption by the kidneys, which conserves remaining blood volume. It also causes vasoconstriction, which increases systemic vascular resistance. 3. Activation of the sympathetic division of the answer. As blood pressure decreases, the aortic and carotid baroreceptors initiate powerful sympathetic responses throughout the body. One result is marked vasoconstriction of arterioles and veins of the skin, kidneys, and other abdominal viscera. Vasoconstriction does not occur in the brain or heart. The constriction of arterioles increases systemic vascular resistance and the constriction of veins increases venous return. Both effects help maintain an adequate blood pressure. Sympathetic stimulation also increases heart rate and contractility and increases secretion of epinephrine and norepinephrine by the adrenal medulla. These hormones intensify vasoconstriction and increase heart rate and contractility, all of which help raise blood pressure. 4. Release of local vasodilators. In response to hypoxia, cells liberate vasodilators including K+, H, lactic acid, adenosine, and nitric oxide that dilate arterioles and relax precapillary sphincters. Such vasodilation increases local blood flow and may restore oxygen level to normal in part of the body. However, vasodilation also has the potentially harmful effect of decreasing systemic vascular resistance and thus lowering the blood pressure. If blood volume drops more than 10 to 20%, or if the heart cannot bring blood pressure up sufficiently, compensatory mechanisms may fail to maintain adequate blood flow to tissues. At this point, shock becomes life-threatening as damaged cells start to die. Signs and symptoms of shock. Even though the signs and symptoms of shock vary with the severity of the condition, most can be predicted in light of the responses generated by the negative feedback systems that attempt to correct the problem. Among the signs and symptoms of shock are the following. 1. Systolic blood pressure is lower than 90 mm of mercury. 2. Resting heart rate is rapid due to sympathetic stimulation and increased blood levels of epinephrine and norepinephrine. 3. Pulse is weak and rapid due to reduced cardiac output and fast heart rate. 4. Skin is cool, pale, and clammy due to sympathetic constriction of skin blood vessels and sympathetic stimulation of sweating. 5. Mental state is altered due to reduced oxygen supply to the brain. 6. Urine formation is reduced due to increased levels of aldosterone and antidiuretic hormone, ADH. 7. The person is thirsty due to loss of extracellular fluid. 8. The pH of blood is low, acidosis, due to buildup of lactic acid. 9. The person may have nausea due to impaired blood flow to the digestive organs or due to sympathetic vasoconstriction.